Welcome to this India Global Week session on healthcare collaboration, building a new healthcare paradigm. I'm Edie Lush. I am delighted to welcome to the stage Secretary of State for Health and Social Care, Matt Hancock. Before his current role, he served as Secretary of State for Digital, Culture, Media, and Sport. And that digital aspect has been vitally important during the pandemic. Speaking of COVID-19, for those of us in the UK, there were days during the pandemic when my family and I huddled around our televisions, waiting for the secretary to appear. There were some very dark days when the Prime Minister was in hospital, and I will never forget the moment when the health secretary said, COVID-19 is in retreat in the UK. And that was exactly a month ago, 9th of June. Today, we're going to focus on the importance of the relationship between the UK and India. That's a good place to start COVID-19. So first of all, Secretary, tell me about the collaboration between the two countries in healthcare. Let's start with most recently during the crisis.
Well, yes, during the crisis, there's been incredible collaboration between the UK and India, especially in two areas. The first is health tech, and India, of course, is a tech powerhouse. And across the world, where people have access to technology, that technology has been used not just for the human social contact that people have yearned for and has been made so difficult, but especially for access to healthcare. We've seen in the UK a radical increase in the amount of telemedicine. The proportion of our primary care GP surgeries offering video conferencing has gone from 3% to 99% during this crisis, and we work with a whole number of Indian companies to help make that happen. The second area is the supply of medicines. Prime Minister Modi has called India the pharmacy of the world, and it's true. And I've worked with with my opposite number in the Indian government to ensure the safe and continued flow of medicines during the really difficult days of the crisis, and that has been achieved all the way through. And I'm very grateful to the work of the Indian government in helping to make sure that that could happen. So we're both countries that have faced this and are continuing to face the challenge of COVID, and we've got a lot to learn from each other.
So I wonder if you could say more about the contribution of Indian healthcare professionals in the NHS, and perhaps what this new visa regime means to those professionals.
Well, this is incredibly important. There's an increased number of people from India who are working in the NHS. Of course, the NHS is one of the most international organizations in the world. And through its history, it's drawn people from around the world in service. And we have not only do we have a very high number of people from India working at all levels in the National Health Service, but that has recently increased. And in the last 2 years, figures published this morning show that India is the second highest in terms of countries from around the world from which people have come to the NHS. So it's an old phenomenon, it's an old partnership, but it's also very recent and very real as well, especially in terms of big increase in the number of nurses coming to the UK. We introduced an NHS visa about a year ago. And this cuts both the cost and the bureaucracy of getting a visa to come to the UK for those with health qualifications. And I'm delighted to see the numbers going up, people using the NHS visa, and there's a lot more to come.
You spoke about the pharmaceutical industry. I wonder if you could tell me a little more about the contribution of India's pharmaceutical industry to producing quality and affordable medicines for the NHS, as well as further research partners within pharma.
Well, the Indian pharmaceutical industry is one of the world's giants, especially the production of APIs, the active pharmaceutical ingredient, and also at the research end. And clearly, the UK life sciences research is amongst the strongest in the world too. We're very proud in the UK of having made the first discovery of a clinically effective drug. A really old drug that India has produced for years and years, dexamethasone, that is effective around the world. And so the combination of collaboration at the research end, and then also, frankly, we are a very big buyer of pharmaceuticals. Around 40% of our medicines have some part of their manufacturing in India. So we're a big customer, and at the same time, the levels of collaboration on research are important, and they'll be increasingly important in the future.
So I wonder if you could say a moment about supply chains. We're in this moment where some parts of the world are still grappling with COVID-19, and India is among one of those countries. On the other hand, in the UK, we're coming out of it, and I'm one of those people who was obsessed by looking at the curves. And I wonder, however, as we talk about nationalism versus this former globalization of supply chains, I wonder how the healthcare industry fits into that, because as you've mentioned, it's so intertwined, and so it's so important to have that international collaboration.
It is very important. And I think a lot of people are asking big questions following COVID. But one of the things that has stood up despite the unbelievable strain that it was under is the medicine supply chain. It has even in the most difficult times when countries were under full-blown lockdown, we managed to continue with the global pharmaceutical supply chain. I think that there is work to do globally to ensure the resilience of that supply chain, especially for some of the products that are produced in very few places. That is important work for us all, because ultimately, we're all human, and so the pharmaceutical industry works for us all. So there is work to do there, and I think it's something that the UK and India can gain an awful lot out of collaborating on.
So finally, if you could gaze into the future, perhaps just a year or 2 years, where do you see, as Health Secretary, the importance of the UK-India relationship?
Well, I think there's a huge amount of opportunity. We have a bilateral work through the JETCO process to make sure that our trading links are stronger. Of course, as the UK leaves the European Union, so our relationship with India has yet more opportunities. In the area I'm responsible for, we're currently looking to build a health data and bioinformatics and genomics focused partnership with Indian counterparts. And we've just concluded an initial landscape analysis in this space, because I think that the technology, the data, and the genomics, because after all, genomics is essentially the provision of another data stream. You can simplify it as much as that. This is an area where India has huge expertise, and the UK has some of the world-leading research too, and through the NHS also has access to that coherent data structure that can help with the research. So India has the scale, and both India and the UK have the research capability. So I think it's an exciting time. It's a very difficult time, but there's big opportunities too, and we really need to make the most of them.
Secretary of State for Health and Social Care, Matt Hancock, thank you very much for joining us here at India Global Week.
It's great to be with you.